How'd you know dermatology was your calling?
I didn't even know what dermatology was. I wanted to be a surgeon. At that time in my medical school, there wasn't any female representation. There wasn't really any minority representation. And unfortunately, I just didn't see a picture of myself in the future as a plastic surgeon.
I don't think people realize what goes into dermatology. It's not just about, aesthetics and looking good. We really have to move away from these certain stereotypical ratios because that's not what the rest of the world is like.
So I think it's understanding different ethnicities and what looks good in different cultural regions.
How do you deal with hyperpigmentation?
At the end of the day, we can't forget about sunscreen. Sunscreen and darker skin, help me help you. You're spending all this money on all this skincare and you're missing the number one thing. People want clear skin. I think it's the era of social media, the whole glass skin. I'm just enhancing what they naturally have. And
I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. Welcome back, everybody, to Give Good Face podcast. I'm Dr. Anthony Rossi, and I am so excited to have Dr. Mercy, my dear friend, colleague, and at one point in time, we were training together, which we have so many stories to tell you about that. It's unbelievable. But let me intro Dr. Mercy because she's so accomplished, and I just want to make sure people know who she is. You probably have seen her on television as well. Her show, Dr. Mercy on TLC, was a hit. She has a lot of stories from there, but she is a board-certified dermatologist and dermatologic surgeon in Marquette, Michigan. She has multiple practices in Michigan. She does it all, from general dermatology to cosmetic dermatology to surgical dermatology. She trained with me in New York City, and she also did a fellowship at Mount Sinai Health System in New York City. She's just an overall amazing person with a beautiful life story. She's making it all work: family, husband, children, practices. So I want to take a deep dive with her about life in general, but also, of course, skincare, health and longevity, because she and I are on the same tip about that. Mercy, how are you? Nice to have you here.
Thank you so much, Dr. Rossi, for having me. And I'm so excited. I mean, if this is how I get to see you, let's do it. I'm excited.
I know, it's been too long.
I would blush. Oh, my goodness. Yeah. Great introduction.
Yeah, no, I mean, you are such an amazing person. I remember first meeting you, when we were in residency, and I was just immediately drawn to your spirit, your character, and who you are as a person. I think you're just an amazing caregiver as well. And I see how you are with patients, but also your family. Tell us a little about yourself, growing up, where you grew up, where you came from.
Wow, it's been so long. I'm almost celebrating, I think, 20. I'm so bad at math. 25, whatever. A long time. I've been here for a long time.
Yeah.
29 years in this country. So I moved to the U.S. from Nigeria in 1995. I was, I think, 10 going on 11 or 11. My father actually got a nursing scholarship. So he was a nurse in Nigeria. And it was during a time where there was a shortage of nursing in America. So they got a lot of people from the Philippines, from African countries. So he actually got a scholarship to work here. And that's how I ended up moving here. And it was hard, leaving my whole family, my whole friends, being in the cold. I mean, the coldest I ever got was 75 degrees.
I know you always talked about the cold and how cold it was. And I don't like the cold either, so I could relate.
Yeah, so it was crazy moving up here, but I'm the oldest of 4 kids, 3 girls, 1 boy. My dad was in nursing. My mom was a nurse also, but no one was in a physician. So I kind of grew up, in the hospitals, in the background of healthcare. So they never forced me to become a doctor. I just always wanted to become a physician.
And then what drew you to dermatology? How did you know dermatology was your calling?
I did not know dermatology was my calling. I didn't even know what dermatology was. You remember in med school, at least my med school only had 2 weeks of derm.
Oh, for sure, yeah.
Your 3rd year of medical school. I wanted to be a surgeon. That I knew. And I thought I was going to become a plastic surgeon. At that time in my medical school, there wasn't any female representation. There wasn't really any minority representation. And unfortunately, I just didn't see a picture of myself in the future as a plastic surgeon. And a plastic surgeon actually said, "Have you ever thought of dermatology?" I'm like, what the heck is that?
Yeah.
So I tried it out and I never looked back. I never went back for my rotation. I did 1 month of plastic surgery and I never went back.
That's so interesting, because we talk about that a lot. I'm at the hospital as well. And for the med students who are listening and watching, it's really important that you see yourself in your mentors, right?
Yeah.
And that's, I think, when we seek out mentorship in medicine or anything in life, we really want some sort of representation to understand, like, hey, I can do this as well. And, surgery is one of those fields that for a long time was male dominated, less females, but now it's becoming, definitely more populated with females, and then, just different races. Again, medicine back in the day was a very male, white dominated, field, but hopefully now it's changing.
Yeah, especially surgery. Looking back at it, I looked at all the male plastic surgeons. They were great. They were fantastic. They
Yeah.
were the ones that actually drove me into dermatology, but they were all divorced. They never saw their kids. They were kind of angry, and I'm not an angry person. I was like, I don't want this lifestyle. But obviously that's over, long over 15, 20 years ago, and it's changed. It's not the same anymore. You see females and minorities in surgical fields having a family and living fulfilled lives. But back then I just didn't have that. So
yeah,
I'm
I think
thankful.
Yeah, I'm thankful too, because I think it's really important for us to have good mentorship as med students, because you sometimes feel a little lost, when you're going through the hospital and you're like, oh wow, like what am I going to do with the rest of my life? Like how is this going to play out? And I think it's really important that we know that we can have a family, you can have kids, and you have two now, right?
I have two. I have a 7-year-old named Lily and a almost 3-year-old named Daisy. I love flowers, if you can't tell.
Of course, yeah. And your practice is called Lily Dermatology.
Yeah, it was named after my daughter, my first daughter, Lily. So I got to find something for the second one.
Yeah, I know. So you need to open up another branch. And so, you've had a great career, and I want to take a deep dive into what you think are the best treatments that you've been doing lately, what you do on yourself, because you look amazing as well. But tell us a little bit about the show too. Like you had Dr. Mercy, you were on television. What was that like?
Well, before we talk about that, let me give you your flowers.
Oh, okay.
You taught me a lot of stuff that I know. I mean, you and one of our friends, Rajiv, were the ones that motivated me and actually helped to encourage me to go into surgery. I mean, you've known my journey.
Yeah.
So I want to give you your flowers. I mean, you're talking about mentorship. I mean, you
Oh,
were always very supportive. You were always very encouraging. It was so many times when I called you in fellowship on the nerve breakdown.
I remember that. But I knew you had it in you. I was like, she's a rock star. She's gonna, just it takes a certain person to do it, right? Because I mean, what we're talking about is Mohs surgery, reconstructive surgery, cosmetic surgery. It can be a lot, it can be all encompassing. Like sometimes it takes all your energy and all your focus because you want to deliver the best for the patient day in and day out. And, it's a lifestyle it can be sometimes so demanding.
Yeah. So I want to say thank you because you got me through fellowship. Taught me a lot of things that I know.
I love you
all the time. So you're a great mentor. You've always been great. So thank you. As you were talking about mentorship, but you were one of the ones that definitely was critical in me becoming a Mohs surgeon. So.
Amazing. Oh, thanks. And so all the med students out there, you need to find a mentor that's going to help you and motivate you, even when things are tough. So always reach out. What was the show like? I mean, you saw so many different patients from all over the place, right? It wasn't just from Michigan. People were flying in to see you.
Yeah. So people always ask me, how did I get the show? Because if you know me very well, I'm not the most I'll pop up on Instagram here and there, but I'm not the most consistently posted. I go through spurts, but I'm like, okay, I'm going to post. I'm not going to post.
But you got dance moves too. I seen you.
So it was during COVID, actually. And I think it goes back to that whole representation thing. Yeah. So I think it was during COVID, 2019, 2020. There was a lot of Black Lives Matter, a lot of stuff with racist stuff going on and racial profiling. And I think people just wanted to see different representation on TV. So they found me on social media. They actually just called my office. I thought it was a joke. They was like, this is Discovery, call in and we want to interview you for a show. I was like, okay, I hung up.
You're like these spam callers.
And then they called again, and I was like, okay. So they actually like, I had to interview through all the VP, this and that. And they actually came to Michigan to watch me operate. But it took almost a whole year to get the show going. Then COVID hit and, all of the stuff you had
For
to go
sure.
through. So we actually had a casting director that got people off of TikTok, Instagram. I did not know there's a group for any kind of disease you have on TikTok.
Talk about support groups. Yeah, exactly. I know.
Yeah, like there's like a whole support group for any condition that you have.
That's
So we
amazing.
did casting through TikTok, Facebook, Instagram.
Wow.
And we interviewed people with crazy skin conditions and amazing stories. And we did it in my Lombard, which is a suburb in Chicago. And we did it in that practice. And it was crazy. It was life-changing for me. And it also pushed me as a surgeon. A lot of the things I did on the show, I mean, you've seen it. We don't really, that doesn't walk through your door every day.
No, that's what I'm saying. You were seeing like these extreme cases, and I was so proud of you because I mean, I know you, but watching you on TV, just like exuding light, energy, love, and like compassion for, these people coming through your door, it was amazing.
I mean, it wasn't scripted. A lot of people think it was scripted. We change a few things here and there. Obviously, we don't go and get our own patients in the waiting room. So that was a little scripted.
Yeah.
But the surgery, everything I said, everything I did, the outcome, it was great. I mean, all those patients are still my friends. We still keep in touch. But as you know, with any notoriety comes backlash.
Yeah. How was that?
It was hard, because everyone always compared me to Dr. Sandra Lee, who was amazing. I mean,
we love her too.
Dermatology and made it a well-known field, but I'm different, but it was always like, you would never be as good as Sandra Lee. You would never be as this. And I'm not trying to, I would never be able to fill her shoes. I'm glad she opened the door for me.
Yeah, totally.
I can't fill her shoes, but it was a lot of backlash for that. And then you talk about stalkers and weird, it got crazy.
Wow. I didn't know that.
Yeah, it got crazy where I was scared to be home alone. Like stalkers would show up.
Oh my gosh.
Pictures of their body parts for me to sign. Sometimes not very, private parts.
Damn. That's the unknown part of notoriety and fame.
Yeah. So even just with the one season I did, it was a bit much. I mean, I love the patients that I worked on. Like I said, I still keep in touch with them up to today. It pushed me to be a better person, to be more empathetic, a better surgeon. And one thing I wanted to highlight about doing the show is, as dermatologic surgeons, we're very good at what we do. Like, we're badasses.
Yeah.
There's a lot of things you can do on the local where you don't need to put the patient to sleep. I mean, I did 20-pound lipomas, and at some point I was on the spinal processes, I was.
You're like, I'm remembering neurosurgery now.
Yeah. Neurosurgery. But there's a lot of stuff that we do that people don't realize we do.
Yeah.
Or give us credit for, that we can do. And that was one of the most important things about doing the show is, as dermatologic surgeons, once we're badasses, we're just as good as any other surgeons out there. And I don't want to say we might be better, but we can go toe to toe. Let's do it.
Yeah. Hey everyone, I want to take a quick break from today's episode to introduce you to a fantastic tool, Hygge Health Light Therapy. This light therapy device harnesses the power of red and near-infrared light to promote skin rejuvenation, reduce inflammation, and even help with collagen production. It's a safe, non-invasive way to brighten up your complexion, ease muscle tension, and improve your mood, all from the comfort of your home. I've seen remarkable benefits with light therapy, and Hygge Health makes it easy and accessible for everyone. So if you're serious about glowing from the inside out, Hygge is your go-to. Check out hyggehealth.com and use code GiveGoodFace for an exclusive discount. Glow brighter, live better with Hygge Health. I mean, we have a really unique understanding of skin biology, wound healing. I don't think people realize what goes into dermatology. It's not just about, aesthetics and looking good. Obviously, that's a big branch of dermatology, but we do a lot of wound healing, a lot of inflammatory disorders, a lot of allergy and immunology, which I know you know about too. But it's really interesting because you're doing all that the patient's awake, you're having a full conversation with them about like their life and their kids, like,
which is the best part.
which is the best part because you learn so much. It's like your patient's not asleep. And I've met so many interesting people and have heard their stories, which, make me feel good inside as a human.
Yeah. So that's one of the biggest things is one, showing representation and also just highlighting what we can do on the local and how well we do it.
Yeah. Because you do liposuction as well, right?
Yes, correct.
Yeah. And how do you feel like, is that procedure increasing where you are? Is it decreasing because of GLP-1? Is it?
I haven't done live. I actually stopped doing lipo maybe about 6 months ago. Not by choice. I don't know. I think my arms got tired.
Yeah, it's a lot.
It's a lot of work on your shoulders and joints. But I think the GLP-1, I mean, I would like to take it. I can't take it.
You don't need it.
But it's doing great wonders for people. I mean,
know.
Outside of the, so-called Ozempic face and hair loss. But I think it's saving people's lives. And I think used well, I think it can make a difference for a lot of people's health.
Yeah, I think in the future, we're going to take a deep dive with another physician on all the GLP-1s, but it's sort of a game-changing, revolutionary medicine, for health in general, but also aesthetically, it's changing people's lives as well.
Yeah, and the whole fact that it stops like drinking and like drug addiction, like that's
I know. There's so many interesting things that are coming out about it. What are you seeing now, like most trending where you are aesthetically?
Where I am is kind of in a rural. It's a little bit more rural. It's weird. Like
people still want to look good, though.
Yeah. Oh, of course. You'll be surprised the farmers that come in and they want their Botox and filler.
I love it.
I think Botox is still reigning. Fillers is still reigning. A lot of people are interested in getting rid of their hyperpigmentation. So, lasers, chemical peels. It's weird. Like people want clear skin. I think it's the era of social media, the whole glass skin. Even my 70-year-old, wants a CO2 laser and lip filler. Never had filler in her life. 70, 74.
Yeah.
She wants filler. So I think we don't have to age like our grandparents and great grandparents. Just even with a little bit of extra cash, you can, look and feel your best.
I think it's, we're in this era of, exactly like you said, it's accessible for the most part in the right hands, like with, board certified, trained people, it is safe, right? There's minimal downtime. I mean, you and I both sort of keep up on what's trending and what's not trending, but I think you and I both have the same aesthetic, like less is more. Sometimes more was more back in the day, but
Both look crazy there for a little.
Yeah. I mean, you and I were both like chemical peeling, like way back in the day. I mean, what's your favorite procedure? What do you think has the most bang for your buck for skin?
Skin type 1, 2, 3, if you can get an erbium or CO2 laser or some kind of resurfacing.
Yeah.
And you have the time, I think like that's like
that's the gift that keeps on giving.
It just everything.
What about for darker skin types, more melanized skin? Just for the audience, types 1, 2, 3, those are Fitzpatrick phototypes. There's also 4, 5, right? So, what about darker, more melanized skin? What do you like?
Chemical peels are still great. I think in the right hands. I mean, we were trained very well in chemical peels.
Yeah.
So I think chemical peels is still great. Radio frequency microneedling. I think it's amazing. For me, I usually do like my lower jaw and neck once or twice a year.
With radio frequency?
Yeah, with radio frequency microneedling. For me, though, I feel like when I do my cheeks, because I tend to have pretty high cheekbones, I've noticed a little bit of like volume loss.
Oh, interesting. Yeah, a lot of people talking about that on social media. Like, tell us about that.
So when I've used it, I've noticed around my eyes, I've looked a little bit more sunken and my cheeks looked a little bit less full. So I've actually, my nasolabial fossa, I've actually stopped treating those areas with radio frequency microneedling. I think it's great for the jawline and neck.
And that's because the needles that are penetrating then also send this radio frequency that's supposed to heat up the skin and the collagen and tighten it up over time. But there is some aspect that it may be also melting some of the subcutaneous fat.
And I've noticed it in myself, but I think not every patient experiences that. I don't think it's universal.
Yeah,
For me, I did notice it after once or twice when I did it. So I just focus jawline down.
totally. No, I think it's super important. Also those are great skin tightening procedures. Like you said, the lower face, like we can't sleep on the lower face, right?
No.
I know everyone's very much concerned about their forehead and their mid face, the cheeks, but the lower face actually, I feel like ages people very drastically.
Oh, of course, of
Yeah.
course. And as you were talking about melanized, darker skin tones, there was this taboo that we black don't crack or whatever, all these sayings out there. But a lot of darker skin patients are getting a lot of these procedures. I think there's an increase in Botox in darker skin patients. And one thing that's always been a taboo is lip fillers, because as people of African descent, we're naturally known to have fuller lips.
Yeah.
But not everyone has fuller lips.
Of course.
And,
Yeah.
and if you have fuller lips, you still want it enhanced. Everything could always be better. So that's one thing I've noticed when I was in Chicago and even in Michigan. There's starting to be a lot of, melanized skin and darker skin patients requesting lip fillers and cheek fillers. And there's a labial, so I think it's everyone now.
It's interesting because when I teach the residents and fellows, if you read the textbooks or if you read certain like papers from, back in the day, they'll tell you about the ideal lip ratio is like 1/3 to 2/3, like 1/3 upper, 2/3 lower. But those are all based on like Western European, Caucasian ideals, right? And so I think we really have to move away from these like certain stereotypical ratios because that's not what the rest of the world is like.
Yeah, no, that's correct. So even sometimes when I have, someone of African descent or Mediterranean or Hispanic, sometimes I just enhance their Cupid's bow.
Yeah.
Like, put a little volume. We're not doing a full syringe because I'm just enhancing what they naturally have and not really giving them full on volume. So I think it's understanding different ethnicities and what looks good, in different cultural, regions.
Yeah. And it's not just face, it's also body, skin tone. I did some work in Ghana. I never made it to Nigeria. I need to go back, but
good. I started doing this mission trips now. So.
Oh, really? Oh, nice. I have to come. With you. Yeah. For everyone at home, Mercy and I bonded because when I was working in Ghana, the family that I was living with, we would watch Nigerian films. Because I don't know if everyone knows, but Nigeria is a powerhouse for film.
Yeah, Nollywood.
Nollywood, yeah, which was amazing. And it was a lot of fun. And like, I learned a lot. And it's so interesting because what, people idealize is different all around the world. And, I spent time in Korea and seeing their aesthetic is also very different, right? So I think it's important for us as dermatologists to understand, the cultures that are out there because all different patients, like you said, are going to walk in and expect that we know something about them.
No, that's correct. So like I've had patients where different providers have turned them away because they're like, you don't need this because you're this. You don't need this because you already have this, but can you make it a little better? Can you enhance a little bit? So I think just understanding different cultural, norms and just like you said, the different ratios of the face makes a difference.
How do you deal with hyperpigmentation? Because honestly, obviously you and I both do a lot of lasers. I just did a 1927 thulium on me. So if I look a little red and rosy, that's what it's from. I'm like in my peeling phase right now.
Yeah.
But I love it. It's great. But how do you deal with hyperpigmentation? Because even on darker skin tones, right? Yes, you can get hyperpigmentation a bit easier because of the reactive melanin, but you can also see erythema and redness, but it shows differently. And I don't think people really understand that.
I think that there's still a big role for chemical peels.
Yeah.
And I think, when I get hyperpigmentation, I usually get it in darker skin. So I treat it differently. You talked about the Fitzpatrick skin types 1, 2, 3, lasers. Hydroquinone is a good mainstay. I don't use it for more than 6 months.
Yeah.
On patients and I have them cycle it. But I think there's a big role for the acid, like the chemical exfoliants. Glycolic is great. I think people underrate glycolic acid. Glycolic acid is great. Lactic acid is great. Salicylic acid is great. But at the end of the day, we can't forget about sunscreen. I think you're going to take we could talk about that.
Yeah.
Sunscreen and darker skin, like help me help you. Like you're spending all this money on your procedures, on all the skincare, and like you're missing the number one thing.
Exactly. And I think so many people, because they think they have darker skin types, that the sun doesn't really affect them. But what they don't understand is that, yeah, the sun is causing hyperpigmentation from the UVA, UVB, but also they are getting a degree of inflammation as well, right? So
Oh, of
there's
course.
probably some redness that's there that's showing up in different forms.
Yeah, because even I don't know how we can change this notion in society. You know, it's like my grandmother didn't use sunscreen and she aged to like fine wine, you know, like
Yeah.
no, you look at all these people in Africa and all these people in like, you know, Mediterranean areas and Southern America, everyone's aging great, but I'm like, no, you know, their skin looks like leather and there's still a high chance of skin cancer. By the time you see it, it's already at an advanced stage.
Yeah. You and I
You know?
both have cut off skin cancers off of more melanized, darker skin types.
Yeah. But I also think that the skincare industry also hasn't really kept darker skin types in mind. So if you're making a sunscreen that's not elegant for me to use, I'm not going to go out like Casper the Ghost.
Yeah,
So,
exactly.
you
Exactly.
know, so I think it's both ways. But I think 2024, 2023, 2024, I think sunscreen has gotten so good.
Yeah, it's amazing. I mean, the technology is amazing. There's more micronized forms, right? There's, the chemical sunscreens go on more sheer. It's important. Tints are always, fun too, because like they can blend in, but you need to create, if you're going to create a sunscreen with tint, you need to create many, many shades,
And most people don't, most of the skincare companies don't. They do
Yeah.
like 1, 2, or 3.
Yeah.
I mean, we won't name any brands. I don't know how you want to do it, but some are trying.
Totally.
Even when we go to the AAD or different, and I'm like, I have no faith. I'm
Yeah.
sorry. Like, it's a few brands
Yeah.
that do it, but still, I just stick to my chemical. I'm like, you know what? It's fine.
Yeah. I think if you're going to put out a tinted sunscreen, you need to go all in and create, hundreds of shades, because
Yeah.
that's what's represented out there.
Yeah. And as you know, I mean, you have your own skincare line, Dr. Anthony Rossi. It's hard.
It's hard.
For me.
Yeah.
It's hard. So it's not the easiest thing. So I always think about that when I tell my patients to wear sunscreen. And I would prefer they wear mineral sunscreen. But obviously, you know what that looks like with the white
Yeah.
cast on the face. A lot of companies are doing better with that. So, I'm like, just find a chemical one, wear it, reapply it, put your makeup over it. I would like that over nothing, but it's hard. It's hard.
No, I hear you, but I always try to reinforce it because, even, in New York, I'm seeing hyperpigmentation a lot, and it's combination. We know combination therapy works probably the best.
Mm-hmm.
A mixture of like topical formulations, chemical peels, lasers. But, I'm always like, you need to wear some sort of UV protection, right? It's got to happen.
I have that fight with my darker skin patients. They're like, my skin already has an SPF 13. So what am I? Da, 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 da. I'm like, you still need it. You're protecting your skin. And I even made a mistake once. We went on vacation, my 5-year-old at that time. I don't know. I was a bad dermatologist and a bad mom, and I forgot. And she got sunburned.
Oh, wow.
Like, even in my head as a dermatologist, I'm like, she's fine.
Yeah.
She's fine. And you can see like the bathing suit lines. And I'm like, oh my God. So we can still burn. Like,
of
even
course.
me, I can still get darker. We can still burn and we can still have damage to our skin and, and still get skin cancer. So
it's important to understand like different, weather, different climates. Obviously, when I was working in Ghana, I saw a lot of like issues arising from the sun, right?
Mm-hmm.
Like, lichenoid dermatitis, interesting reactions. And first and foremost, I mean, it's an environmental stressor. Like we need to, the sun has so many great benefits like vitamin D production, but in darker skin types, you actually make less vitamin D from UV exposure. So I always encourage my patients to supplement too.
Oh, of course.
Yeah.
You have to supplement, especially where I am in Upper Peninsula, Michigan. I mean,
you're not seeing a lot of sun.
Yeah, which is great for my skin.
Yeah.
It helps me with anti-aging, but you have to supplement. So I have them supplement with vitamin D. I think everyone should supplement with vitamin D. I mean, I think there's been so many roles that we see now for vitamin D in every single organ system.
What are your go-to tips, speaking of the Upper Peninsula, for winter skin? Because we're in it right now and New York is like dropping. but I know you're already hitting the cold. So
Yeah. I like hyaluronic acid. I always cut, even me, me and you, we can go a little crazy on the
yeah,
skin. We can go a little crazy. So I cut down on the chemical peels. I cut down on the exfoliants.
totally.
You don't need to exfoliate every 2-3 days, maybe
Yeah,
once a week, once every 2 weeks. I might not even do any chemical peels at all, maybe once every few months. I
yeah.
cut down on like irritants on my skin and just put a lot of moisturizers, hyaluronic acid. Yeah, I just keep it simple in the wintertime.
Yeah, I end up using my overnight cream during the day too because
Thicker.
yeah, you need to go bigger,
Yeah, with the moisturizers and sunscreen too. I do cut down on my SPF in the winter, so I'll go down to 30.
Yeah.
In the summertime, I'll go up to 50.
As dermatologists, we recommend 30 or above, but if you're not a good reapplier, then sometimes that extra SPF is going to be helpful to give you a little bit more time until you have to reapply.
Yeah, and as skin cancer surgeons, I tell my patients, I think a lot of people are actually pretty good about wearing the sunscreen. It's
Yeah.
reapplying the sunscreen that I think everyone falls short. You have to reapply it every 2 to 4 hours if you're going to be outdoors. Like just because you put it on in the morning, it's done. Like,
Yeah.
yeah,
It's not like a one and done.
it's not a one and done. Like, so I give patients a lot of small samples if they're traveling to keep in their pockets, little travel sizes. So I think that's the biggest thing is reapplying the sunscreen outside of just the initial application of the sunscreen.
I mean, you and I both have cut skin cancer off of people's lips. Like,
Oh, yeah.
it's sad to see like skin cancer is just growing on people's lips because it's such a sensitive area. And I really tell them like they have to apply it, especially on the bottom lip.
Everywhere that the sun is gonna see. So whatever that means to you.
Yeah, exactly. Just because I think you're such a role model for people and especially for, also female medical students going into, a surgical field. Like, how do you balance it? Because you have a lot of
Balance, there's no
responsibility. You're a business owner, you're a mom, you're a wife, you're a sister. Like, how do you do it?
You have to have great support system around you. And I don't really think there's a balance. I think that, we always want a balance. There's no balance. Whenever you're doing something at a high level in one area, something suffers. So I'm not going to lie to you and say like, there's a balance. When I did the show, I will film for 14, 16 hours. By the time I would get home, my kids would be sleeping.
Yeah.
There's no balance. I didn't really see my husband as much. I didn't really see my kids as much. But I know it was a temporary time. After I did the show, I went on a 2-week vacation, to make up for the
Nice. I mean, I know your husband Tony. He's a gem. I mean, he's amazing.
He's great. Poor guy.
I mean, everyone deserves a Tony in their life.
I just be gone a lot.
And he's super smart and highly successful too. Like,
yeah, he runs the business part of my practice, and people are like, "How do you do it?" Honestly, I think it's because of him. People think I do all this. I literally just show up and treat the patients. Everything else he does. He does the hiring, the expansion, kind of the marketing. He's really the business side. I just show up and I'm like, okay, I'm like, hey guys.
But you both give good face. I mean, you both are the brand. I mean, it's amazing.
So, and having good support system, I have a great nanny. My family is great. They do help babysit. They do help, like watching the kids. They will come down to Michigan sometimes so I can go to a conference. So there's no balance. When I'm doing well in one area, honestly, another area is suffering. And too, exercising. I mean,
we're both getting after it.
I know. I just started a fitness journey last year, and I think it's kept my sanity. Oh my God. You didn't tell me about the benefits of mental health.
Oh, I know. I honestly, I work out. My trainer, Sam from Exis, was on this podcast, and we were just talking about the routine of working out is really similar to like a routine of skincare, right? There's something like very grounding to it. Like, I know I start my day every morning working out. Do you do it in the morning or the afternoon?
I'm a night. I know it's.
Are you?
A full day. I go and beat myself for an hour and a half. I just can't. The morning, it's like my brain's like.
But I love watching your videos about working out because honestly, I feel you. I feel it. I feel the energy in there.
Like it's. I think it's made me better, and it saved me after a long day. I can just like ground myself and just let everything go and know that this is an hour and a half for myself.
Yeah.
So I think it's important.
Yeah, I turn off my phone. I don't keep it next to me. It's actually the simplistic, just going through the routine of the workout is really like, it just resets my brain.
Yeah, no, it's helped a lot. So unfortunately, there's no balance. You do your best and you make up for your inadequacies.
Yeah. But I think just acknowledging that and like just telling it like it is also really helpful, because I know a lot of med students always come to me and they're like, how do you do this, this, and this? And you're like, honestly, you have to have like a system, but also you have to be flexible too, right? Like life is about flexibility because things get thrown at us all the time.
How do you balance it? Because you're giving talks, you have a skincare line, you're doing surgery, you're writing chapter books. Like, I mean, you're out there. How do you do? I look up to you and I'm like,
No.
who does it all?
No, sometimes I feel like I'm doing it well, and sometimes I'm like, wow, I need to like, prioritize and cut back. And I think it's okay, right? Like you said, like in the winter, you cut back on chemical peels, you cut back on exfoliation. There's got to be times in your life where you cut back as well and like refocus your energy, right? Because it's like a law of thermodynamics. Like energy is not created or destroyed, right?
You better teach us, Anthony.
Yeah. Teach the kids. It's conserved, right? Like we have to conserve our energy for what matters. And, at some point in your life, this is going to matter. And some point that's going to matter. But it's a balancing act, I think.
I agree.
But I don't have all the answers, but that's why I'm bringing you on.
I don't either. I think having a great support team, pray, exercise.
I love that.
And just do your best.
Mercy, you're amazing. I just love talking to you. I mean, I can't wait to see you in person, but just having you here is like it's like recharging my soul.
Oh, thank you. Yeah. I always love.
Thanks so much. And anyone who's in the Michigan area, you got to check out Lily Dermatology, right?
Yes, so we're in the Upper Peninsula, which is a area that most people don't know.
Now I know.
But it's Marquette, Michigan. It's great. It's beautiful. We're on Lake Superior. It's very clean. It's very peaceful, very tranquil. I mean, my little pocket of peace, just doing my thing. And
yeah, if you have a mystery diagnosis, she's there to solve it.
I'm there to cut it out.
Yeah, to cut it out. Exactly. I'm so grateful for your advice. I think a lot of like younger doctors are going to like really appreciate that. And, they should check out dermatology. You never know if you're going to like it.
Dermatology is a great field.
It's so competitive, but I think, if you're going into it for the right reasons, because you really want to invest time into people, we have like such long-term patients. We don't see people for a one and done. Usually we usually take care of them for an extended part of their life. So I think having that continuity is really fun too.
Oh, before we log off, what is new and greatest in New York for skincare? I'm in Michigan. It's a little different aesthetics. What are you doing in your practice that's like, what's like new? And
what people are really focusing now are on the more regenerative type of procedures, like you said, and combining things like CO2 or erbium or thulium lasers that are going to like stimulate your collagen production with things like skin boosters with hyaluronic acid that's just going to like really help hydrate the skin but keep a very natural look. I think in New York we're really becoming in our natural era, right? Like looking good, feeling good, but also, not looking way out there, Yeah. I think the pendulum has swung, back to a little bit more of that natural look, which I like. I think enhancing what you have and your skin type and really helping it glow from the inside out is amazing. And the regenerative like lasers, the biostimulatory fillers, like those are really helpful, and even like the skin boosters, like, Skin Vive from with hyaluronic acid has been really a great like addition, because especially when it's cold, you need that natural moisturization factor.
Yeah. Are you doing a lot of the salmon DNA?
I haven't gotten into that just because I still like to see more studies. I know these are peptides that people are injecting. They're mainly overseas. Like we haven't really seen them, manufactured here yet, but coming in from overseas. But some people really think it does give the skin a lot of glow. I've been using a lot more PRP or PRF in skin because it's like from your own body, it's your blood. It helps to stimulate growth factors in the skin and really helps to improve the texture, the integrity, and it does give you that glow. Also, people like it because it's from their own.
I gotta visit you sometime so you can,
Yeah, same. Just like back in residency.
Yeah, back in residence where we could just, like the whole afternoon and just work on each other.
Yeah, exactly.
Thank you so much. Thank you.
Thanks so much for listening to this episode of Give Good Face. Subscribe on Apple Podcasts, Spotify, YouTube, and wherever you listen to podcasts. And follow along on social at Dr. Anthony Rossi and at Rossi DermMD.